My name is Christy Melton, and today I'm going to talk to you about hand sanitizers and why I believe they should not be a requirement in school and my children should not be using them in an excessive amount. I'm sure many of you have used hand sanitizer at some point. I know I have, and I know my children have. I try to limit the amount that they use it because it isn't good for them to use it a lot. This year, when my daughter received her school supply list for school, hand sanitizer was a requirement for us to supply to the school. I did not think that children need to be using hand sanitizers because these little bottles of hand sanitizer have 62% of the alcohol in them. There's two different kinds that they can have. One is the isopropyl alcohol, the other one is ethyl alcohol. And I just do not believe that this is something that children need to be rubbing all over their hands. Why would you want your children rubbing alcohol in high concentration all over their hands, where they're constantly putting them in their mouth, and things are absorbed easily into your bloodstream that way? I know that I don't want my children using it any more than is necessary. According to LincolnCountyNV.com, hand sanitizers contain high percentage of ethyl or isopropyl alcohol, and there have been reports of children needing medical treatment after ingesting small amounts of hand sanitizers. Having children use hand sanitizers is dangerous and unnecessary. Not only can they cause medical concerns, they can severely dry out hands, causing problems and making them crack and bleed and easily getting infected because of the wound. Another key ingredient in hand sanitizer is triclosan. It can do more harm than good. It was first made in the 1960s as a way to kill germs in medical settings, but is now showing up in soaps, toothpaste, deodorant, shampoos, children's toys, among many other hygiene products. According to otherwords.org, it kills all bacteria, good and bad, that it encounters. But in lab studies, it has shown that many hormones can be left unbalanced in the body, such as estrogen levels, testosterone levels. It can impair your thyroid function and can harm fetal development, which is a very crucial stage during the pregnancy. Is the early stages when the brain is developing, and it can cause them to have lots of developmental problems. And even with all of this, hand sanitizers are still being used in school. I'm not saying it's unsafe to use it in moderation, but with extensive use, it can lead to problems. In our fast-paced world, we are looking for a fast fix for things, and instead of finding a bathroom and washing your hands with warm water and soap, we are turning to hand sanitizers. According to upstatepoison.org, the best method for removing germs and dirt from your hands is good old soap and water. In using soap and water, you ensure that your hands are clean and germs have been washed off. Hand sanitizers only kill the germs. They will not clean the dirt from your hands. And why would you want to compound health problems by using something that can cause more problems than it fixes? There are alternatives to alcohol-based hand sanitizers for use in schools that are effective and safe for our children. According to Livestrong.com, the active ingredient is benzalkonium chloride, which is a topical wound antiseptic. If we all teach our children to wash their hands regularly and not to be sticking them in their mouths, you can keep them from spreading germs, and you won't need the hand sanitizers all the time. Schools don't need to keep them in all the time. Now, I'd be happy to buy a large bottle of soap for the schools so that the kids have that to wash their hands, but I refuse to buy alcohol-based hand sanitizers to be used in schools where children have easy access to it. It's not put out of reach like the bottle states on it. I encourage everyone to give up hand sanitizers, or at least limit the amount you use. If your child's school requires them to have it, then buy the alcohol-free one. You could help keep a child from becoming sick from ingesting the hand sanitizer.